during that time, I just felt so let down by the healthcare system and all of the people who just told me there was nothing I could do or there's nothing wrong with me. And I just never wanted anyone to feel that way again, like anyone that was at least entrusting their lives and their care for me.
Welcome to the Alternative Flight Plan. I am Dr. Kristin Barnes, and I am out of the ready room and into the treatment room. I'm going to leverage all my aviation and naval leadership experience and use it in the healthcare field to try to create some massive change in how we approach health and wellness in our country. On today's show, we have Dr. Brianna Cardenas, who's a colleague of mine. I love her to death. She has an amazing story, and she's going to tell you about it today. But in brief, she's got almost 2 decades of her own personal struggles with complex illness. And as a physician's assistant, she has not only learned how to navigate that, but she's helping other people heal from complex illness as well, using a combination of conventional and alternative medicine. So stick with us. We've got lots to share with you. And here we go. Welcome, Dr. Brianna Cardenas. It's great to have you here.
Thank you. Thanks so much for having me.
I appreciate it. I asked you on the show because you pretty much embody everything that I'm trying to do in these first 6 episodes, which includes battling complex cases and navigating both the conventional and the alternative medical worlds to try to find some sort of go-between or overlap to find your best way forward for health. So with that said, tell us a little bit about where you are now and what you're doing.
Well, thank you for that high praise. I so appreciate it. So I am a physician assistant. I usually tell my patients to call me Bri or Brianna because my doctorate is in medical sciences. So basically when I publish papers and present at conferences, I'm Dr. Cardenas, but for the most part, I just like to keep it casual. I like to build rapport with my patients. And a lot of the reason for that is that most of the patients that I see are really, really sick and dealing with complex cases, ranging from things like long COVID to conditions like Ehlers-Danlos syndrome, which is hypermobility, connective tissue disorder that affects all of the organs and systems in the body and has a lot of overlapping conditions. Typically, by the time people see me, they may not think that healthcare providers are on their team, unfortunately. And so my biggest goal is that my patients feel comfortable and at home when they see me. So,
tell me a little bit more about that. What is it about their experience with the medical field that makes them feel like the folks that are supposed to be their advocates are not on their team?
I think a lot of it is because the care that people traditionally have access to through insurance is in like the allopathic wheelhouse, or like what we think of as like Western medicine. And I'm using air quotes for people listening. A lot of that medicine is really dictated by what insurance can and can't let us do or will allow us to do as healthcare providers. And one thing that I have found in my years as a healthcare provider is that a lot of times, because we're so incentivized to just get through patients, see 30 people a day, we need a diagnosis code to have insurance pay for any type of treatment. We depend really heavily in allopathic medicine on lab results and imaging results, having like a very clear cut, like there's a brain tumor or you have lupus or you have this marker in your blood that shows, this is what we're treating. And a lot of times with the chronic conditions, like I discussed earlier, or the ones that I see, there's not a blood marker or a test that's going to show very clearly what's going on in this patient's body. And so a lot of times the experience of pain or fatigue or things that are not super easy to quantify or nail down get overlooked or dismissed, or a lot of patients are often told that there's nothing wrong with them or they're imagining their symptoms. And they see, gosh, some of my patients have seen 20 healthcare providers. Some of my patients have literally given up on going to doctors for the last 10 years before they come and see me. So I think it's just that people get tired of being told that they're imagining what's happening to them and they just get worn down.
I think for me personally, that's one of the reasons I'm in naturopathic medicine as opposed to doing like an osteopathic program. My experience has been with military medicine. As a career naval officer, I was beholden to the Navy flight surgeon to make sure that I had my upchit and I was able to fly. And if I ever came in with a complaint, generally speaking, it was here's some Motrin and go away. Or I didn't tell him at all, which isn't any better. But it is very frustrating to go to this person that is supposedly has all this knowledge and a database of things that are supposed to help you, being told that either A, there's nothing wrong with you, or B, there's nothing that we can do for you.
Yeah, it's really, really frustrating. And, it's just people shouldn't have to go through that, right? And it's a huge departure from what I think medicine maybe even 50 years ago was. And it doesn't leave people feeling like their care team really has their back a lot of times.
Yeah. One of the things I think is interesting about Ehlers-Danlos and the connective tissue diseases that you focus on is that we're just now learning about them, meaning the insurance industry might be so far behind or the medical field might be so far behind that we're not even able to address this with the current medical system. What are your thoughts on that?
Yeah, I think part of it is because EDS, that's the abbreviation for Ehlers-Danlos syndrome, does not have blood markers that show up. And the most common subtype of EDS is the hypermobile EDS subtype. And it makes up about 95% of the cases, and it doesn't have a known genetic marker. And so a lot of times people are just kind of falling through the cracks. And as a result, there's sicker and sicker and sicker people by the time they actually get a name for what's happening to them. And one thing that I don't think a lot of folks know about how peer-reviewed literature and like what we call like the evidence-based forms of medicine work is that we need controlled studies. And people that are really sick and have a lot of things overlapping in their bodies don't make very good controlled test subjects for like pharmaceutical drugs or interventional treatments. And so it's really hard to study EDS because it's difficult to control all the variables in the way that would allow for literature to get published on this condition. It was first described, I want to say, like by Hippocrates or somebody, one of the ancient philosophers. Like it was a long, long time ago where the syndrome was first recognized and described. But again, I think because there's not like the blood marker or the genetic marker for it, a lot of times patients get the symptoms diagnosed as like, you have chronic pain syndrome, or you have IBS, or you have nausea, whatever the case may be. And then they just take meds and kind of like survive through their symptoms. And then it's not until much later when their health suddenly becomes decompensated and they can't manage their symptoms very well anymore that they're like, wow, I need to actually find somebody who can put all these pieces together for me.
Yeah, and it's interesting. A lot of what you just described isn't really a diagnosis. It's just a symptom description. So, how do you put that together within the context of finding a root cause and then addressing the root cause with some sort of intervention that the conventional world might have?
Absolutely.
Okay, so we have all these complex patients out there. We have a medical system that, through its own fault or not, isn't really able to help these people. What is it that's different about what you're doing? Because I know you're helping people.
Oh, thank you. I think one of the things that makes my approach to care unique is that I've been through these things as a person with EDS myself. I had misdiagnoses from you're overweight and depressed, and that's why your back hurts, to I've heard nurses say I had Hispanic panic when I went to the ER with what's called tachycardia, where my heart was racing because, spoiler alert, my brainstem was getting impinged. So that was actually the cause of my tachycardia, not my Hispanic background. But the amount of misinformation and I think the amount of burnout that a lot of our healthcare providers are facing makes them really not in touch with what patients are going through. And I think because I have the lived experience of not only living in a body that has this condition and the associated overlapping syndromes and comorbid conditions, but because I've been through the runaround that the traditional like allopathic world has put me through, I don't ever want to do that to my patients. And one of the first things I do for my patients is I offer free 15-minute phone calls on my website because I don't want to take people's money if I don't think I can help them. And if somebody is strapped for cash or can't afford my care, I want to make sure that I at least point them in a direction where they can start to get some help. So at the end of the day, it's really important for me that my patients know that someone has been through this and they're not alone, and that no matter what, I'm not going to give up on them, I think is the biggest thing.
Okay. You mentioned something just a second ago, and I think this is a really important part of the conversation. My own experience with getting the healthcare I needed because I was in service required me to go outside the system and pay cash. And so pretty much for my entire adult life, I've paid cash for services, even though I have what is considered reasonably good healthcare. And of course, there's the context around services is really important because I was able to get ibuprofen. I was able to get my wisdom teeth removed. TRICARE paid for me to get put back together after I was put in the ER after a bicycle accident. But TRICARE hasn't done a great bit of support for me when it comes to things like acupuncture and nutritional medicine. I know that you're a cash-based business, as am I. How do you have this conversation with patients? Because the insurance barrier is real.
Absolutely. So I let patients know that I didn't find this out until I started my own practice, but it actually costs money to be credentialed with an insurance company. So as originally when I started my practice, it was just me. Now I work with a company of like great like-minded professionals. And I think that I was actually shocked as a new business owner and new practice owner to find that it would have cost me thousands of dollars to even be on the panel to be in network with health insurance, like Blue Cross Blue Shield, for example, through state of California where my practice originated. I didn't know that. I also didn't know at the time that if a healthcare provider is paneled with any insurance, so let's say I took like top of the line gold tier, like the Cadillac PPO insurance, that would prohibit me from taking cash from patients who are on Medi-Cal or Apple Care in Washington or like any state-funded insurance programs. And so that would make it so that even if a patient had put together like a GoFundMe or they had a family member who was like, hey, I'll pay for your care, I legally wouldn't be allowed to take it. And so that would basically exclude me from helping the vast majority of people who otherwise would benefit from my care. And also they dictate a lot of what I am allowed to do or not allowed to do. Insurance can take 6 to 8 months to reimburse services that I provide, and they can just say no. So if I gave someone 2 hours of care and billed for that 2 hours, the insurance could turn around and say, nope, we are only going to pay you for 30 minutes of that. And so as a starting practice, I just, as somebody who doesn't have like the generational wealth or like a successful practice handed down to me from a, parent who's a physician or something like that, I just couldn't afford to take insurance, quite frankly.
I think that speaks volumes that patients can't afford insurance and the physicians can't afford insurance. And so we are left with this situation where we have to meet on the outside of the system. I think one benefit of not working with insurance, because I've done both. In my residency in Seattle, I was credentialed with many of the major insurances that will accept naturopathic medicine, of course. This excludes Medicare, which is a really important exception. So I can order tests that I wouldn't have been able to order before and get covered. Or I can do clinical interventions that wouldn't have been covered. And it's just all on a flat fee. And so in that way, I feel like it, even though a lot of patients still won't come to me because they don't have access, because they want to use insurance, the folks that do come to me have just now opened up a cornucopia of options. And we're going to get into some of those in just a second. A cornucopia of options that can help start to reverse the trend of the serious diseases and the complex conditions that they're dealing with. So with that said, I would like, if you don't mind, sharing some of the things that you do with patients in the course of coming up with a treatment plan for something really complex like long COVID or Ehlers-Danlos?
Number one, I listen to them. Whatever things that like
it should be laughing, but it's
no, like I hear you because it's like what a concept, right? But it's just like that's one of the things that people will say to me is they'll just be like, "Gosh, you haven't interrupted me once," and I'm like, "Is this the bar?" Because like, gosh, it makes my job really easy if if that's all I have to do. No, I offer a myriad of things. So I interpret my own imaging. You would be shocked and appalled at the number of air quotes normal MRIs that I look at that have been bred as normal and actually have like really serious neurologic things going on. Especially in my patient population, it's like a disease of hypermobility. So a static image doesn't really do a good job of showing what's going on a lot of the times. But things that require like major surgeries or have been debilitating people for 20 years are things that I'm like, yeah, that bone there is 3 times as long as it should be. Or you see that part of your brain that's like sticking out of your head, like it shouldn't be doing that. And so like the fact that these things are getting read as normal just gave me this whole shock and awe and disappointment and grief moment as a healthcare provider. I felt like I lost a lot of trust in the system when I realized the frequency with which this was happening to my patients. But one thing I do is I look at my own images. I find out what happens in my patients' day-to-day life. So I ask them about, how are they sleeping? What are the foods that they're eating? What are the stressors in their life? What does their support system look like? So I find out kind of like the parameters of their life and what feels like a treatment plan or set of parameters in a treatment plan that would work for them, which is something that my naturopathic colleagues have been doing for like the whole, extent of their careers. But it's novel, unfortunately, in like insurance-based care for things like that to happen. And then I also provide a modality called Fascial Counterstrain, which is the manual therapy that you and I both do, and one of the things that we've gotten to connect over. But doing anything from this manual therapy to sometimes I offer injection therapy, like trigger points. I don't need to do that as often now that I have Counterstrain. Doing the imaging review, offering supplements, nutritional strategies, or medications that treat kind of the root of the illness. Like if you have micro clots from long COVID and no one's ever tested you for those things, like we ought to find that out and manage the micro clotting so you're getting enough blood to your brain. Or if someone hasn't told you with EDS that your mast cells, which are part of your immune system, are part of what's degrading your connective tissue, we ought to control those types of things. So really kind of going upstream and finding, hey, here's the root of your problem. Let's address the root and make some lifestyle modifications so that we can get you feeling better. It tends to be kind of the approach that I take in general. So yeah, it varies patient to patient, and it depends if I'm in person or online. So I live in Washington, but I also see patients remotely in California, and then once a month I go to California to do the Counterstrain. So it'll vary depending on a given day, but certainly not stuff I could have done in insurance-based care for sure.
Yeah, and it is expensive. The prices I charge here, where I live on the Olympic Peninsula of Washington State, are low, relatively speaking. But I do know that you work for a reasonably established practice that is expensive. So how do you couch that conversation with somebody? You're like I'm worth this amount of money, and I can help you. I mean, how do you because and I'm going to throw out a number. I don't know exactly what it might be, but just say, a first visit with you. And this is very common. Like I've seen a lot of medical doctors who actually charge more than this, but say an initial appointment with you costs $400, and then a required follow-up costs maybe $250 or $300. To somebody who is already on either Medicaid or Medicare, how do you justify that? How do you talk to them about that?
I let them know that I recognize that barrier exists, and as such, my goal is not to make it so that person needs to come back to me every month. I also let people know that my goal is to work myself out of a job with them and basically get them healthy enough that they don't need me forever and always. Like they are kind of used to oftentimes in some of the insurance-driven care where it's like, I'm going to come back to my pain management doctor once a month and get my pain pill refill. That's not what I do. I also let people know that I'm spending on average 4 to 5 times more time with them in our initial visit, and have a skill set from all kind of corners of specialty. So I've worked in pain management. I've worked in gender affirming care. I've done ADHD and family medicine. I have done hormone replacement therapy. I have done urgent care. I have worked in a little bit of neurology and rheumatology from my pain management background. So having kind of all these backgrounds helps inform my decision making as well. I think also letting them know that the care that they're going to find with me as somebody who already has an established network of specialists who understand these conditions is likely to save that person years and years of time.
I think that's really important right there, is the fact that if you are investing in something up front that is going to work, and we know it's going to work because you've got a proven track record of helping people, it's going to not only save them money in the long run, but they might actually feel better. That's crazy.
And I think that that's one of the hard things to buy into, honestly, because I know that when I was at my sickest and I was bedbound and in a walker and in a neck brace, if someone would have come in and said, hey, spend a couple hours with me and you're going to leave feeling better, I would have been like, ha ha, very funny. I don't know who you think you are, but I don't know if you've seen someone as sick as me. Like, I'm really struggling here. I'm surely not like your other patients, type of thing. And it's understandable that that skepticism exists because it sounds kind of too good to be true. And a lot of the people that come to me, they'll say like, oh, my doctor just said, hey, come to your guys' clinic. Or my doctor said, hey, you're the EDS person. I don't know what you're actually going to do for me. And they leave with happy tears because they're like, oh my God, I didn't think that it was okay for me to have hope about my health again. Sorry, that makes me a little emotional because I'm just, it's so affirming to be able to offer that to people when at one point I was on the other side of that treatment table. So,
well, I think for a lot of healthcare providers, that's why we get into what we're doing, is because we want to legitimately help people, and having the freedom to do that instead of being artificially restricted by a bureaucratic and monetary system is so frustrating. If you are willing, I would love to hear a little bit more about your own struggles, because I think it illustrates really well what you do and how you got there.
Absolutely. So I have EDS. By the time I got diagnosed when I was 20, I had been on opioid pain medication for 3 years. I woke up from my second surgery at age 18. It was my knee surgery with the most excruciating back pain I had ever felt, and went around for several years like that because when I tried to get help or go to physical therapy or get some type of diagnosis or even an exam, I was told things like, I think you're just too depressed they're depressed that you can't play softball anymore, hon. Or I think that, maybe you're just really stressed with college and that's part of why you're just not healing the way that you ought to. Or your x-rays are negative, so, maybe seeing a therapist would help you to cope with your pain a little bit better. And at that age, I believed it, right? I was still very conditioned to trust everything the doctor said, to just basically assume that, hey, if multiple healthcare providers are telling me this, it's got to be me. And I know that as a teenager, I was like, I know people said getting older was hard, but God damn, this is brutal. I remember just thinking, okay, this is what my life's going to look like. And in my athletic training rotation, because my bachelor's degree is in athletic training, and that was my first career of sports medicine, at my senior year, I had been dealing with this already for about 3 years. One of my care team members or preceptors actually took me aside and said, "Hey, can I take a look at you and just evaluate you? Because I see you limping. I see you leaning over the treatment table. Like, you're clearly in severe pain. Like, can I just take a look?" And I happily let him, and he evaluated me, and he was like, "Well, your SI joint, which is where your spine and your pelvis meet in the back, so like your low back by where your jeans pocket would be." He said, "Your SI joint is dislocated on the left side, and your pelvis is basically at a right angle to itself. And that's probably why your back is hurting." And he did something called muscle energy techniques, where you basically like put applied pressure and have the person use their own muscle strength, and levered that thing back into place with like the loudest pop I feel like I've ever heard a joint make, and put my SI joint back into place. And I immediately had like 70% pain relief, and thought to myself, like, wow, it literally took somebody just caring a little bit about what I was going through and seeing me as a human being and taking the time to put their hands on my body and actually touch me and see like something's wrong here. And then it took 10 minutes to fix it. This was years of my life that I've lost to opioids and to pain, and having to say no to trips and gatherings with my friends because of this suffering. And it went away so fast. Like, that, I think, to me was very formative, because I was like, gosh, like, really all it takes is being the person to listen to make a huge difference in someone's life. But that helped a lot. He then asked about my history, and I had shared, yeah, I've dislocated my shoulders, I've dislocated my knees, I've already had a couple of surgeries, I'm pending my third joint surgery already. I'm 21 at this point. And he was like, yeah, no, let me take a look in your mouth. There's some dental things that go on with EDS. And he's like, yeah, I'm pretty sure you have EDS. Like, this is not normal for this to happen. And at the time I figured, okay, hey, I'm flexible. Cool. Like, I was queen of the sit and reach in grade school. Like, it's just no big deal. I just need to be a little more mindful with my flexibility and not, do contact sports and things like that. And I went through PA school thinking, hey, this is no big deal. Sure, I've got aches and pains. Sure, I can go to the chiropractor every now and again, but I'll manage it. And pain's just part of my life. No big deal. And I just went through school like that. And I worked in pain management, and I went into pain management because partially I wanted to learn how to help other people who were suffering like I was. And then I started collapsing at work, and I started losing my vision. I started forgetting how to spell my name. I started getting lost in my house over the course of several years that was going on. And I literally thought that I was getting early dementia or something like that. I had gone to probably 15 doctors at this point. I was 27. And it turned out that I had a spinal fluid leak, and my brain had herniated into my neck. And it was normal MRIs, normal therapy, so on and so forth. And I just pushed through it because I couldn't get disability since I didn't have a diagnosis of what was happening. I just started using a walker and a cane at work because I just had to push through it, and would go to work in a post-surgical neck brace because it felt like my head was going to fall off of my neck. And ultimately, it was the kindness of my boss who said, hey, you need to go get another MRI downstairs. Like, you have fainted one too many times at work. Like, this is not okay. And we looked at the MRI together, and he's like, no, it looks like you have meningitis and your brain is like falling out of your head. We need to send you someplace that's going to be able to help. And he sat and he Googled the authors of literature with me. And we found a doctor, 2.5 hours away, who was in Southern California. And I showed up at that ER, and I got the help that I needed. But it took a long time to get there. And it was a long, slow recovery involving over 20 procedures in my spine and back surgery. And I think during that time, I did ultimately need to take some time off of work. But during that time, I just felt so let down by the healthcare system and all of the people who just told me there was nothing I could do or there's nothing wrong with me. And I just never wanted anyone to feel that way again, like anyone that was at least trusting their lives and their care to me.
So the current medical system being what it is, had you on opioids at 17, and it took you a minimum of a decade or more to finally unravel what was going on. So you're essentially disabled.
Yes, I have a disability placard. I have had various disability resources. My doctor was kind enough to discharge my student loans because I can't work full time. I work about 15 hours a week, and that's kind of what I max out at.
Okay. I am really curious how you got from being disabled to where you are now, because I know what the part of the answer is, and I want to dig into it more. There is a certain amount of conventional care that you still receive, yes?
Yes. For example, I had a lot of epidural blood patches where they injected blood into my spine, and the goal is that it seals the leak, kind of like fix the foot. And so I had a lot of that done. I had regenerative medicine, like stem cells, platelet-rich plasma injected into there, and I did have surgery on my back to repair one of the leaks. Definitely would not be upright. I don't think I would be alive without that care, honestly.
Yeah, and that is important to mention, because my message isn't that conventional care is bad. I think there's a place for all of that within the medical system. When I got hit on my bicycle in July of 2022 and I ended up in the ER, I don't want a naturopath or an acupuncturist, making sure that I'm not internally bleeding. There's places for those things in the pre-care and the aftercare, but modern medicine is miraculous in so many ways. Like, you would not be here right now without some of the things that have been done for you in the context of conventional care. But I also know that you wouldn't be here without a little bit of alternative help. Can you tell us a little bit more about that, please?
Totally. So one of the things that I kind of have the way I've compartmentalized, like, where do, these more traditional, like Western medicine, insurance-based healthcare things sit in my toolbox versus like the naturopathic and osteopathic and manual therapy types of things. I think that the insurance-based Western medicine stuff helped me survive. And then all of these other complementary modalities helped me live again. I really can't say enough about fascial counterstrain, which is the manual therapy that we briefly touched on. But I went from having to have about 3 to 4 procedures in my spine every year, and I was happy with that. Even though each of those was a 6-week recovery, I was like, this is still half of my time that I can live upright. I'm great with this. To after my first session of fascial counterstrain in 2022 with Kelly Barnes in Portland, which shout out to Kelly as like one of the people that really like righted the ship, so to speak, and put me back on track. I have not ever needed a procedure in my spine again, and it's 3 years later. I really highly credit that modality with.
Yeah. Let's stop there for a second. So you were getting 3 to 4 procedures a year that took 6 weeks to recover from, and you had one treatment with fascial counterstrain, and you haven't had to have another procedure since. Am I getting that right?
After the first treatment, I have not needed a treatment again. I get counterstrain more frequently than that. So I have had, probably, once or twice a month for the last couple of years, just because, I've got a body with an illness that needs some maintenance. But
you haven't had to go back to get an actual procedure that required 6 weeks of recovery.
That's absolutely correct. Yeah.
That's amazing. Like, what is this? And I know what the answer is, but I want you to tell me, what is this amazing stuff? What is this fascial counterstrain?
So fascial counterstrains are really nice and gentle modality that helps put the body in a position of ease after the practitioner does a diagnostic workflow. And that diagnostic workflow helps find the area of the body that's the most stuck and the most rigid, so to speak, that's kind of locking up the rest of the system. Then the practitioner can treat the body in order and can feel actually a pulsation occur at the tender points involved that represents the lymphatic pump turning back on and inflammation draining out of that tissue. And so, in effect, what's happening is that counterstrain is finding the root cause, alleviating the inflammation around that stuck structure, and then giving that part of the body a better chance to heal. And I really do think that doing it in that way, rather than just, because I had tried trigger points, massages, I had gone and gotten stem cells injected around my scar. Like, I had done so many things to try and help. But I think being able to get to the root of where the restrictions and inflammation were occurring and causing the most dysfunction in my movement patterns. Like I couldn't even bend down and tie my shoes. And I said I was the queen of the sit and reach. And so for me not to tie my shoes and bend down and get there was really a lot. And even after the first session off of Kelly's table, I stood up and I bent down and I tied my shoes. So it's huge.
Obviously, I think it's huge too, because I've invested the last 2 years of my life in getting training in fascial counterstrain, which is no small feat. And in subsequent shows, I'll get into that. But I'm going to push back on your word complementary for just a second, because I don't understand why we're calling something that had such a powerful impact on you complementary, as if it's this extra thing like fries on the side. And obviously I believe that because that's how I practice, and fascial counterstrain and acupuncture, which I think does very similar stuff, is a huge part of how I operate. But I think it just points out how the language that we use around, well, the language we do for everything, like words matter, but the language that we use with how we approach medicine, health, healing, like it's the difference. And I know that you're familiar with this as well because of the thesis that you did, and happy to share more on that if you'd like. But the difference between calling psychedelics drugs and the difference between calling psychedelics medicines, there's a very distinct difference in that approach. But calling the stuff that we do adjunctive or complementary or alternative is, I think, really unfair when you consider the power of healing that lies in them. I would love to hear your thoughts on that.
Totally. No, I'm so glad that you pointed that out, because that just speaks to like how I was conditioned, right? So going through allopathic medical training in PA school and then teaching PA school for a couple of years, anything that wasn't like labs, prescriptions, procedures was considered complementary and alternative medicine. And so given that I was immersed in the culture of like, this is the medicine that we do and everything else is like the complementary side, I think, clearly has even still permeated into my vocabulary today, even with the reverence and appreciation that I have for all of these other modalities outside of that Western medicine structure. But because that was just the lens through which my training occurred, that's, such a good point. It's just, it sticks with us as far as how we describe things. But I tell my patients all the time, like if I went to a desert island and could only take one thing with me to manage my care for the rest of my life, it would be fascial counterstrain. Like not even a question.
It's pretty, I mean, it looks miraculous. And every time I get off your table, it's like you've done your magic again.
Same. I mean, right back at you.
Right. Is the first episode in the alternative flight plan. Part of my message is how can we reframe that, and how can we start introducing people to something that should just be called medicine instead of alternative? In China, they have this thing called Chinese medicine. In America, we call it this alternative thing, which really irritates me on a lot of levels, because in China, again, it's just medicine. And it has somewhere between, we're not even sure because a lot of it's been lost. Chinese medicine has somewhere between 3,000 and 5,000 years of empirical data to show that it works. And yet somehow in the United States, it's still something that people are like, oh, it's not my thing. There's not enough studies. Okay. You're missing the boat on something that could be really, really powerful in my mind. Now, fascial counterstrain has its own challenges. It's a new thing, relatively speaking, within the context of the diagnostic thing we call fascial counterstrain. But I think I'd go as far as to say there's a lot of body work and other things that look very, very similar that have gone on for millennia. So if we want to help people find medicine, find alternative medicine, what are your recommendations? Like, how do we, you kind of stumbled upon it, right? Like, how do we start educating people so that they're not just stumbling, they start looking for it?
Ooh, I think there's a couple of key points here, and it takes a team effort. So For the people that already know about it, like us, or like patients who have benefited from fascial counterstrain, we can talk about it and spread the word, which is what we're doing today. For people that have benefited from fascial counterstrain and have had to pay out of pocket for these services, I let people know that you can speak to your state commissioner on health insurance. So it's usually called like the state board of the insurance commissioner. Varies a little bit by state, but you can petition those state boards to start to cover this therapy and get it covered by insurance, or at least reimbursable by insurance payers. So at least you can recoup some of the fees for that. You can talk with other practitioners who do different types of manual therapy, who the majority of them don't take insurance for the same reason, and find out what they're doing to move the needle on some of these legislative pieces with the insurance to start to get better reimbursement, so that way we can afford to take insurance for these services. That way it becomes more accessible. What I like to do is tell students about it. So when I taught PA school, my personal mission was like every single student who I teach is going to know what Ehlers-Danlos syndrome is and recognize the signs and symptoms of a spinal fluid leak. And I can very confidently say that anyone who has sat in one of my classrooms will know how to do that. And I've had students text me and be like, oh my God, I diagnosed EDS today. And I'm like, high five. It's amazing. So just teaching about it and going back and doing guest lectures or telling students who otherwise wouldn't have ever heard of this modality, like, hey, this exists, learn about it, train in it, take a class. Let me just treat you for 20 minutes just so you can feel it and know that something like this exists. So those are some of the things that I think can start to make it a little bit more broadly available and at least well known, so that people think, hey, after I have my car accident and I made sure I wasn't internally bleeding, I know who I can go to start feeling better right away. Once I know that, nothing's acutely broken, fractured, like I can go get on Dr. Barnes' table, or I can go see Brianna, and I'm going to feel better and not be laid up in bed for 6 weeks.
Yeah. I think more than anything, I want people to get curious. I think curiosity and humility are two of the really, and I realize I'm being harsh, like not every medical doctor lacks curiosity or lacks humility. That's unfair. But I think the system prevents us from capitalizing on our curiosity. Like if I were to go see the Navy flight surgeon and I've got something wrong, why doesn't he ask me, like, I wonder what's going on, instead of take 3 ibuprofen and call me in the morning. In fact, don't call me, just go back to work. I'm being snarky. But I think one of the things I love about naturopathic medicine and working in traditional world medicines like traditional Chinese medicine or 5-element acupuncture is that it gives me the space to be curious. And I wonder, that's what I say to myself. I wonder, that's it, I think. It's like, I wonder, ... which opens up the ability for me to take in things that maybe I wouldn't before, or get new ideas that I wouldn't before, or even if it's look into new diagnostic tests, which are conventional, that I wouldn't have before, because the curiosity is there to see what's going on at the root level and see if we can capitalize on both forms of medicine that we have in the United States.
Totally. And the systems in place just totally disincentivize that. I mean, some of my colleagues that have been in insurance-based practice for the last 20 years or 30 years, gosh, I'm one of those people where I'm like, the 90s was only 20 years ago. But my colleagues will say, hey, in the 90s, I could see 8 patients a day and afford to staff my office and pay, my employees and get reimbursed well enough by the health insurance companies that it made sense for me to be able to go to their house, to follow up with them, to call them at the end of the day, to not have patients wait 2 hours to see me when they show up for their appointment. And now the reimbursement, which is what the insurance pays the doctors, has been cut by those companies so much that in order to make the same amount of money that they were making 30 years ago, they're having to see 4 or 5 times as many patients. And so there's only so many hours in the day. And the only way you can offset it is either to not take insurance, to close your doors, or to just pack patients in like cattle. And unfortunately, that's really kind of where we find ourselves with a lot of insurance-driven medicine. And I do not know a single colleague who's like, yippee, I love insurance. Like every single one of my colleagues that takes insurance, I can see the light in their eyes slowly fading. Gosh, like they are so burnt out. They are just completely wrung dry by the end of the day. And a lot of it is the guilt of having to practice within the constraints of what insurance will dictate that they're allowed to do. And it's not fair to anyone. So yeah, your snark is well-founded. And I think the majority of healthcare providers listening to this would probably totally agree with you.
I feel like I live in a special place here in Port Townsend. I don't know a lot of the providers over at our local healthcare, which is Jefferson Healthcare, but I've seen their names on a lot of paperwork, and I've talked to a lot of patients about the providers that are over there. And I think they're unusually open to all the naturopaths that are working in the area. So a lot of times what I do with my patients is I tell them how they can navigate both systems. Here's what you can do with your insurance. Here's what you can do with me. And I work almost more as a consultant. As when I'm not doing a procedure-based something like acupuncture or fascial counterstrain, I'm definitely like a consultant. Like, here's how you can take advantage of, go get these tests, see if they'll run these, see if you can't get this procedure, see if you can't whatever, and then come back to me. And then we're going to do the other half of it, which is diet, lifestyle, and any kind of body work we need. And a lot of people really resonate with that because it gives them the ability to use the two different systems. They do get something from all that insurance they pay, and they can still access somebody they feel has their back and can look at a little bit of a bigger picture.
Totally. Yeah, I think the best way that we can do these things at this point is work with the tools that currently exist in the systems that are currently in place, and then do what we can to educate people about the alternatives and do the actionable things. Like I know that you've done so much with the Port Townsend Psychedelic Society to just move the needle legislatively, so that way the access can be more open for people to be able to seek not alternative, but should be first line levels of care so that they can get healing.
Just medicine. And I'm sure we can God, there's so many more things that we can unpack from this conversation between psychedelics and Counterstrain and all the other things. But it's time to wrap up. I am really grateful, number one, to have you as a colleague over in Seattle and Pulsebo. The people of Seattle that find you, that have all the issues that they're working on, I know benefit from the alternative care that you provide within a conventional setting. So thanks for being on the show today. If you have any last parting shots, I would love to hear how people can find you. How can they, get you on Instagram, all those things.
Well, thank you. The feeling is so mutual. I'm just so grateful that we get to be in each other's lives and that patients get to see you. I have a company called Healed and Empowered, and my website is healedandempowered.com. You can find me on Instagram at Healed and Empowered. And there's two arms of what I do. One is medical practice and one is health consulting. So health consulting is for people all over the world who want a second opinion on their images or their hypermobility related concerns. And that's just through the website that I provided. And then my medical practice arm of what I do is through NeuroVeda Health in Seattle. And so if you want to see me as a patient and you are in California or Washington, you can go to NeuroVeda, so Neuro, VEDA, like Ayurveda, neuroveda.com, and give them a call and come get on my schedule.
I would go one further and tell people that are listening, if they want to contact you, that they don't need to have Ehlers-Danlos, any kind of complex thing. Give us a call. I want to take a crack at it, and I know you do too. So thank you, Dr. Brianna Cardenas. Thanks for being on the Alternative Flight Plan.
Thanks for having me.